Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Manager at CSCLA, and I'm honored to welcome you to this week's webinar titled Finding Wholeness Through Your Cancer Journey, the Integrative Healology Approach. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speakers, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speakers into the Q&A feature found at the bottom of the Zoom window. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we'll get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Salles Araujo, a palliative care physician, and Justin Laube, an integrative East-West medicine physician, are co-founders of the Institute for Integrative Healology. Their work brings together whole person care, Eastern medicine, acupuncture, mindfulness, nutrition, nature-based healing, and expanded approaches to consciousness and meaning. They created Integrative Healology as a supportive space for patients and loved ones navigating serious illness, grief, trauma, stress, and life transitions. Their approach honors healing in many layers: body, mind, heart, spirit, community, and meaning, and aims to help each person reconnect with their inner resources, resilience, and wholeness. It gives me great pleasure to welcome today's speakers, Thais and Justin.
Hello, everyone. So good to be here. Should we start sharing screen? Yeah? Okay.
Yes.
Share. All right. So thank you, Abby, for the introduction. So we'll go straight to our talk on healing through wholeness, connection, and expanded states of consciousness. I'm Thais, and here's Justin. So we're ready. We're introduced. Just a little bit more of me. I'm a palliative care and hospice integrative physician, and originally from Brazil. And this work with supporting patients with cancer and their loved ones really goes close to my heart. My personal history is of my dad passing away actually from cancer on my first year of medical school. And this really marked how my career and what I do now. So, which is continuously like a big portion of the patients I care for do have or had cancer. And yeah. No,
I'm Justin, and I trained at Integrative, the East-West Medicine program, linked to UCLA. And I'm coming out of a deep personal and professional sabbatical, learning about healing and trauma. And so that's really also what I've specialized in trauma healing. And this healology is really the creative birth of the two of us together and sensing what patients and what we would want our own family and ourselves to receive to support through challenging life transitions and diseases. So we're so excited to be here. So,
yeah. So today's outline was start by defining healing versus curing, reflecting on healing as this non-linear process, covering ingredients to help this healing, and also this role of, we keep repeating this expanded states definition. And then we're going to have some direct exploration of acupressure, qigong, nature as therapy, and dignity therapy. And we leave space for reflection and Q&A at the end.
So like we do with our patients and in our own personal practice, we have to arrive. I have to be here. So we'll invite a short practice with you. It's an inward practice. So if it's comfortable for you, I invite you to let your eyelids close. Maybe you notice that deep breath that happens when one closes their eyes. And sense if you can feel a little bit of softening in arriving here as you are. That might be settling a little bit into your chair or feeling your feet on the ground. Yeah. And sensing into somehow you're here on this talk, listening to us, and I invite you to sense into what brought you to this specific talk. What brought you here today? What were you hoping to learn? Another breath. This talk is really about healing and the barriers to healing. So what comes up for you when you hear the word healing? Healing. You may notice images or feeling or a word. Yeah. And now we invite you to slowly come back to the room. So we'll move forward now. Thank you for arriving.
So to help us picture and more, we'll bring up a story, Julie's story. Medicine was really presented as like a case example. It's really Julie's story. She's a 51-year-old. She has stage 3 breast cancer, just diagnosed. She's undergoing chemo and a planned mastectomy, which is a surgery to remove the breast. She's a school teacher, divorced. She's living with her 2 teenage daughters. She's having a lot of fatigue, anxiety, insomnia, nausea, and headaches for post-treatment. She's seen by her oncologist and primary doctor. They've prescribed one medication for each symptom. Ritalin for energy, Lexapro for her anxiety, depression, Zofran for nausea, and ibuprofen. With some response and some side effects too. So she was referred to palliative care, which is my specialty, for assistance with symptoms, quality of life, and support. And most important here is like she was really, really in a place of wondering how she could ever feel like herself again and find healing some way. And as well, her family was longing for this. So what does healing means? Like going back to the roots and really looking to the dictionary, heal means to make sound or whole. Comes from this old English root, HL, the condition or state of being whole. Whole is actually the same root word for the word holy, which is sacred, whole, or spiritually meaningful. And wholeness is really the reminder of us that the parts of a whole are interconnect. There is an intimate interconnection of all parts of a whole: physical, mental, emotional, social, spiritual, and natural.
An attempt to define healing has been done in the research. This is one study that is a qualitative interview study where they actually found a number of physicians that their colleagues and peers had defined as healing doctors or very holistic doctors that were role models. And they interviewed them about how they defined healing. And so through their interview, these are some of the definitions. Healing is making whole again, becoming whole again, and finding wholeness. You can see whole being part of that. Healing is well-being and function. Healing is a state of mind. Healing is a harmony between the mind, the body, and the spirit. And healing is a spiritual experience. And these themes, these certain themes that might emerge, of course, this wholeness or coming together, returning. The narrative is really like how one authors one's life and how they're engaging with their day-to-day life. And then the spiritual aspects is around meaning, purpose, and also connection to the unspeakable, the unknowable, and one's place in this earth, in this world. So if you Google healing, this is one thing that we like to do is to see what images come up because they're a reflection of our culture and how we understand the world. So these are healing images in art. So I invite you to soften your eyes and look at it like you're at a museum and take note of the colors and maybe the symbols or images, like the components of it. And sense into what you naturally are moving towards. Personally, I'm a Pisces, and I really connect with blues. I feel very at home. Just sense in what emerges for you as you see these images. Yes. And we're going to continue to help you start exploring your own definition of healing. Another way to look at healing is to look at the poetic art expression. So another view is perhaps the Ram Dass, who a spiritual teacher who passed away not too long ago. He defined healing as healing isn't as much about getting back to the way things were, but about learning to live with how they are now. Learning to live with how they are now. I was raised Jewish, and so we've explored some of the Judaic history, and this is from Rabbi Nancy Flum. The Mishaberach prayer in Judaism, traditionally recited for someone who is ill, asks God for refuat hanefesh, which is healing of the soul, the spirit, and the whole person, as well as refuat haguf, which is cure of the body, healing and cure. To cure the body means to wipe out the tumor, clear up the infection, or regain mobility and rehabilitation. To heal the spirit involves creating a pathway to sensing wholeness, depth, mystery, and purpose. And she finishes with cure may occur without healing, and healing without cure. Cure may occur without healing, and healing without cure. So we'll be exploring this dichotomy.
So, in summary, a recap of what may be defining healing, particularly in a cancer care. This aspect of wholeness, sense oneself as integrated and more than just a diagnosis, more than defined by cancer. The narrative, refining a story that holds both the suffering, the unwanted state, and meaning through it. The spirituality, which is again accepting this depth, this mystery, this something greater than oneself with purpose and maybe refining love and peace. And also noticing this thread of relationship that healing happens in this field of safety, authenticity, and connection. We are intertwined beings. So exploring this curing illness orientation. So modern biomedical medicine is very powerful and has powerful tools to cure. And it also has its limits on view and perspective sometimes. And touching on like this difference.
Like surgery and chemo.
Yes. So curing, what is curing? Is recovering or relieving from disease, right? A treatment that removes or controls the disease. Often the strength and the focus of medicine oftentimes. Like we mentioned, the chemo, surgery, antibiotics, all great. As seeing as like the body is more or less like a machine. It has a piece that's not functioning, and then you remove it. And can be reductionist on its view of like kind of like different pieces as separate, not interconnected as much. And oftentimes it can create a dualism of like mind and body as distinct entities. And the soul and the spirit is really left out as just relegated to religion. The question is, what gets lost when the body is treated only as this machine? So differently, holistic systems view of the body, which is like usually the traditional healing systems, do not like fundamentally split mind, body, emotion, spirit, soul, society, and nature. Some examples of those holistic systems are indigenous, shamanic forms of healing, traditional Chinese medicine, Ayurvedic medicine. They're very energetic um, healing systems. And then the human being is understood as this living ecosystem, always in relationship with others, other beings, nature, and the universe, and the earth, and the beyond. So to illustrate a little bit more in my areas of like in Chinese medicine, the view of cancer in healing, very symbolic, right? Here versus the image, the Chinese medicine, Chinese character for the word cancer. First, we see like a cliff. Illness is representing like a cliff or a high, steep place, like a mountain, in a mountain. And below it is like little squares representing multiple mouths or opening. And this says like I. And meanwhile, the Chinese character for heal or treat is C, Z, and it incorporates the symbols of the little splash of water. Water in Chinese medicine often represents flow, process, movement, and below that is a platform, bringing a stability and meanwhile with balancing. So here we're gonna like reflect on how holistic medicine systems see the body more as a garden versus a machine. It sees like this interconnectedness with and being part of nature, like our body, we're made of water, 70% of water. We have heat in us, like fire, like minerals, like our red blood cells are full of iron to work. And we are continuously breathing in and out air and expanding our lungs. And the element of earth and our relationship with it. And as a garden, our body needs nourishment, rest, movement of the wind, connectivity between the other elements, the sunlight. It goes through cycles. It needs protection. And just like a garden, our body has this innate capacity and wisdom of rebalancing and self-regulating. Just like a tree after fire may blossom, us after a cut, we can rebuild our skin there. And the practitioners seeing the body as this garden that has so much wisdom and needs to be tended and cultivated. The practitioners and the healers are more like as gardeners. They support this innate healing intelligence of the body to find balance. So how can they both work and move together alongside healing and curing, right? Curing and curing teams ask, what disease needs to be treated? Super useful. Seeing the problem and taking it out, right? Naming, taming it. And then the healing teams ask, what helps this person move towards wholeness, like a garden? Those lenses are both complementary. So cancer care needs excellent biomedical treatment, needs all the cancer-directed therapists, and also practice that help restore the connection, the meaning, the body trust, the inner resourcing. So question is, who in our culture bridge this world?
So that tells nicely back to Julia. So is there some complementary approach that could help her with these deeper fundamental existential aspects of her changing? So one way that we help people is to see themselves within a wider map, meaning turning their life into a story. So, looking at Julia before she received her diagnosis of cancer, she had her healthy life. Maybe she wasn't thinking too much about, like getting sick or what that would mean, or her life having some concern about maybe it won't go as long as I thought it would. So she had her own way of being. That's her status quo before. Then at some point, she received news or had a symptom of a call or something that she has breast cancer. And that is this moment, like a lightning bolt, where things can never really be the same again. Completely unwanted, and yet there's a shattering effect that can occur. And it's signified by like a wave of a lot of energy. Mostly these are unwanted states, of course. No one generally wants to be sick. And what that moment sparks was a transition from feeling maybe whole to a feeling of unwholeness, and maybe a state of healthy to a state of uncured or dis-ease, like uneasiness. And themes that, in addition to her diagnosis, like I have cancer, the doctor is giving treatment, which is, and also moving towards cure, which is actually can be very calming and directive and very helpful to have this structure from a biomedical perspective. That doesn't necessarily mean it addresses the deeper things that can emerge around this concept of suffering or threat to one's life, meaning loss or fear of loss, change this that's going on in her, the impact on her family, the doubts, and the purpose level challenges of what is my life now if I don't have as much life. And there's this kind of unspoken thing around death that's usually not discussed. So these are these kind of deeper energies that need a little bit of a different approach than just a biomedical. And one of the definitions from that study I presented of healing, when they looked at all of the definitions and formed one, was this definition. Healing is the personal experience of the transcendence of suffering. Yeah. Another therapeutic approach is that we use kind of as practitioners, kind of to understand where people are at in their process, is to recognize perhaps in this chaos of unknown and sickness area, maybe there is some structure beyond just the something happened and I'm lost. This structure could be considered a mythic structure or a hero's journey. So you take Julia, you take the individual, and you recognize maybe they're on some bigger thing, a bigger journey, and there's some almost like they're in a Disney film, or there's things to do and there's things to learn and there's things to face. That hero journey is a model coming out of Joseph Campbell, and it also links to indigenous practices too of initiation, what around a three-phase process where there's a separation, there's an initiation, which is a big change moment, and then the return. So, for example, let's go to Julia. Like I said, she received the call, the unwanted call, and the wave of I have cancer. Then there's the second wave of treatment, 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 and now, oh my God, there's so much more coming up, both spiritually, meaning-wise, my family, in addition to symptoms. And so this separation can occur when one realizes maybe I don't know exactly if I'll be cured, or maybe I don't know if biomedicine can really help me. That could be a huge cracking point for someone where they go, well, I'm going to go search and explore. And the symbolism usually in films is to go into the forest, to go into the darkness and go on an adventure, really. And with seeking greater truth, seeking maybe facing of this my risk of mortality, and facing the reality that I am not the same that I was before, and facing the emotions that can come through that. And what many of our patients, many people may have found, and in many Disney films, once you go to the forest, it's not just all darkness. Usually something emerges, maybe an ally, a helper, a fairy on the shoulder to direct you maybe where you wouldn't go, or like Rafiki from Lion King. And that supports one to move further along. You could think of this as like a caterpillar going through a transformation. Caterpillar to become a butterfly can't maintain its caterpillar structure anymore. So Julie or someone may be guided into a cocoon or a darkness or a place, or maybe a feeling or a grief that needs to emerge. And that transformation requires literally a transformation from one to another. And after that occurs, then they at some point go back. Maybe they're in the exact same place they were, but they have a new healing, they have a new narrative. Maybe they're more at ease, maybe they're more at peace, maybe they feel more access to presence despite their symptoms. So that's a mythic process that can be happening without us really recognizing, because it's not really discussed much in our culture. So, what are the key ingredients that we have found and others may have found that support this healing path view? One is a present orientation, like we began the talk, is a lot of this mythic and process and healing requires an orientation to presentness, meaning here, now, mind and body, welcoming all, even the unwanted. That's one thing that it can augment this support that. Another is a healing or to become a butterfly requires energy and to support this transformation and some amount of hope. It's hard to heal if someone has really lost all hope. Therefore, they may need a loan on hope. Sometimes we can offer people a loan on hope to help them kind of resuscitate. There's also often people will find spiritual openings. So in that darkness, in that moment when you're laying down and you just can't go any further, and then you suddenly see the stars and have a moment of awe or meaning, can be incredibly meaningful and kind of help people move forward. And we'll be sharing more about expanded states and mystical states. Another essential aspect, and also in trauma care, is trauma, and these things happen not in isolation. And healing path is supported through connection with people in your life you trust, who you invite into authenticity and feeling and sharing, and that you feel safe to connect with. That is an invaluable thing along the way. And then finally, this other ingredient is that this body that is this living, emotional, memory holding thing that we eat and we digest and we poop, and it has so much that it's doing that when we tend it, it actually has maybe more intelligence than our mind will believe. Certain movements that we do, certain things uh, like sensations that we have not noticed. Once one notices that, that can also accelerate a healing path. So this path is oriented towards wholeness. It's oriented towards reintegrating what's already here, our body, our mind, and our memories. It's reconnecting. There's elements of forgiveness too, which is a whole other talk, but about like burdens and holding and loosening of that with the hope and intention that one feels more love, more access, more ease, more peace. So one can move through their life with less suffering and less agitation.
So you touched a little bit on this expanded states, right? Those spiritual openings. And this can be a particularly important resourcing space for healing, to support healing. So what it is, how can we define it? It's actually a term used scientifically to explain for states of mind and consciousness that are outside of the usual way of thinking and perceiving. Actually, the original usual like mind of like task oriented doing things is shifted and allowing us more softness, allowing us to experience greater presence, perspective, connection, and natural insight and meaning may emerge. They can help us become more aware of the present moment and reconnect with our body, our mind, emotions, and spirit. So they may offer new perspectives, inner resourcing, and a deeper sense of connection, like I mentioned, to ourselves and to others and to community, nature, the sacred, and beyond. They requires elements. So what turns an ordinary state of mind to a non-ordinary or expanded state of consciousness is the elements of nourishing, accessing, the intentionality, the safety, the presencing, and the relationship with oneself or others. So here are a few healing doorways to help connect with expanded states, and we're going to cover some of them in this talk and give a taste of it. Nature, meditation, qigong, yoga, spirituality, ceremony, ritual, music, singing, dancing, expressive arts, acupuncture, Reiki, and psychedelic assisted therapy, to name a few. So what experience have felt expanded or helped you feel more present, connected, open, or deeply alive? You may add more to this examples here. Just bringing that to your mind, okay? So we'll start by practicing one. I know how many of you are familiar with Qigong. So qi means life or vital energy. In Chinese medicine, it's all about qi, cultivating qi for healing. And gong literally means cultivation. So Qigong is a Chinese health and healing practice that supports the flow of qi, often done relationally with oneself, being present with the body and breath, and more often in community and in nature. There is good evidence research in cancer patients that can help with fatigue, overall quality of life, and cognitive impairment, actually. So we will do one simple Qigong movement here together so we can all practice. We start by bringing again our presence, our awareness to our hands as we just do, just like there in the picture, we bring our hands down, feeling into the earth below, feeling into the warmth of our hands. Now we're gonna
Mine are cold.
cold. Then we're gonna look into our palms of our hands and connect our breath with movement here, okay? As we breathe in, we bring our hands up very slowly. In, bring our hands up, following with our eyes, connecting with, again, the sun, the sky. And then on the exhale, we're going to bring our hands down. So one more time, practicing movement and breath together. Breathing in, raising our hands. Looking up, connecting to the sky. And exhale. Bringing it down to the earth, feeling the connection with the below. Yes. Again, noticing maybe there is any shift.
I feel warmer.
Excellent.
You notice the shift?
I feel calmer.
Calmer.
Good. So another practice is acupressure or acupuncture. The premising of acupuncture or pressure is that our body, mind, and spirit again is flow of this chi, this energy. And this energy moves through channels in the body. And the acupuncture are access points in these channels to help move energy. And disease and symptoms can be understood as disruptions of flow. So acupressure is putting pressure over acupuncture points. Acupuncture points are usually stimulated with needles in acupuncture practice. So acupuncture is one of the most well-studied complementary approaches for cancer and supporting symptom management with helping pain, nausea, vomiting, fatigue, insomnia, nerve pain, which is neuropathy, improving quality of life, even helping with supporting immunity and anxiety, depression, dry mouth, just to name a few. And again, just to practice together, we'll use 2 points here. First one's called PC6. It's actually very studied, particularly for nausea. So very handy. You can just literally put 2 fingers below your wrist, right in the middle, and just press gently. Just feel again, feel into the the touch of your hand on your palms. As you do this, you may practice just some breaths and presence. And again, similar, can be very supportive, just like a Zoe friend, to help bring your body capacity to regulate those nauseous signals. And now, another one is right in the middle, in between your eyebrows. Just gently massage, just like many call it like the third eye. Yeah, it's very supportive for stress relieving, helping center, settling. You can just press like gentle pressure as you take some deep breaths, feel into it. Yeah, good. Thank you for participating. I'm moving to the next modality here.
Yeah, that sounds great. So just sensing into anything that maybe feels pleasant or nourishing in those last two practices of Qigong. And we're doing 30 seconds, maybe a minute. Yeah, seeing the portability of it. Another expanded state healing um, practice is nature therapy. Nature therapy is taking nature, meaning when we think of nature, I mean, you'll have your own experience with this, but I think of like this, a forest or some sort of thriving ecosystem, and seeing it as a relational ecosystem of all supporting and connecting and of the trees and the light and all of that. And that we as humans engage with natural system to both receive direct nourishment from being in that environment. Many people find it's relaxing, but also to contemplate how am I also of nature and connected. That's where things really accelerate. And so when people go into the forest or into the ocean with this intention of connection and exploring me in relationship to it, it changes the experience. And studies have shown that this being in nature, many studies came out of Japan with their Shinrin-yoku forest bathing concept and then studies where going into these environments, people have report less anxiety, depression, fatigue and pain, improve quality of life. Also, their immune system has changed, their natural killer cells have augmented, and then also people have lower heart rate and blood pressure. So just being there, literally. So then the medicine is being in the nature experience within an intention. And natures don't necessarily need to be forest or you leave your home. They could be with a plant or a pet. They could be with being with yourself as maybe the animal that maybe we are, and breathing and all sorts of stuff happens without my choice. And also connecting to the sun and moon and also through things that are maybe nature is depicted in imagery is really the sky's the limit and there's no limits to this. So I'm going to guide you to about a minute practice here. So once again, see if it's accessible for you to close your eyes. We're going to use the imagery of nature. So I invite you to take a deep breath in, letting it out. Just like we began, a little bit of settling with your buttock on the chair or your feet on the floor or wherever you're located. Now we're going to ask your mind and your body to come up with a place in nature, a place in nature where you feel safe and resourced. That could be a memory, that could be a place you are right now, it could be just created like your dream. That place in nature where you feel safe and resourced. And I invite you to whatever you're noticing, even if you're just noticing your body, that just choose that. I mean, to really step into the door of that, into the forest, into the body. Yeah. Take another breath in, breathing out, slowly coming back. Just in your own reflection about what emerged, what you noticed. I know for me, it just feels like accessible. I connect with my body and body in the forest. So this is a short practice that can connect you if you don't have access to the forest. But imagine if you can get a large amount of nature, how much that can really support someone. Another expanded state practice that we utilize and we find very helpful is music, singing, and vibration. So sound and vibration can be a doorway into emotion. I don't know about you, but if you hear that song, that can it can bring up tons of memories or going back in time. That's connecting to the brain, and there's mechanisms to bring up memory. It also can create expanded states of consciousness. I don't know about you, but certain music moves me and can open me up. Research suggests that music therapy, specifically like music tailored for certain people with certain conditions, like with cancer, when they're offered through a music therapist or they're given a program, that music therapy can reduce anxiety, depression, pain, and fatigue, and also improve hope, just through this nourishing sound, energetic coming in practice. And singing in particular, when you turn your body into a little literal instrument, has been shown to increase IgA, which is a immune antibody to help protect against infection. And also singing can upregulate oxytocin, that feel-good hormone, and endorphins, and help with stress reduction. This is something we use in addition to, which we'll touch on soon, expanded states through psychedelics.
Now covering the use of meaning-centered approach to support healing in expanded states. Some known modalities are like dignity therapy, logotherapy, existential psychotherapy, and other meaning-centered approaches. The essence of the work is the recognition that humans need to feel that life has meaning in order to feel whole, And dignity therapy is a modality often uses like guided conversations and then record them and turning them into a legacy document just to illustrate. It's like a narrative exercise too. So to illustrate again, those are a few reflection prompts that can be used in a guided through a trained facilitator, like if I'm trained in, or even as your own journaling, as a take-home exercise for you, that you can engage with this reflections, like what are the most important roles you have played in life? What have you learned about life that you would want to pass along? And what matters most to you now? What do you want your loved ones to remember? So there's good amount of research too on dignity therapy, and these are some reflections, particularly with patients with cancer, that what it can bring. A reframing of life's meaning, developing resilient cope strategies, cultivating connection, emotional expression. And here's a quote from a participant. There are qualities like love, faith, and hope that never go away. The most important quality I learned from life is love, because it is the most powerful thing we have. You don't have love, you're only an end to yourself. So now moving into expanded psychedelic augmented therapy as a pathway to connect to expanded states of healing. So psychism means mind and or soul, and delic manifesting, the mind manifesting. So psychedelic type experiences may include altered senses, sense of interconnectedness, sense of transcendence, dissolution of time and space, and a felt sense of sacredness. It can be accessed through natural medicines such as psilocybin mushrooms, ayahuasca tea, brews commonly in Brazil, and they can be human-made, such as LSD, MDMA, ketamine, which is the only legal one currently in California. And also, our own body can produce, endogenous means like produced by ourselves, um, substances that can create this psychedelic experience, such as being on prolonged meditation retreats, breath work, drumming on spiritual journeys, ecstatic dancing, meaningful spiritual experiences like birth, dying ceremonies, and trauma healing mythic adventures. These psychedelic medicines have been used traditionally since human existence through ritual and ceremony for healing purposes. And in cancer care, the psychedelic research has been focused a lot on anxiety, depression, demoralization, pain, and existential distress. So just to illustrate, what would that look like? Because many people don't have this idea. On the medical model, the modern way of seeing and applying and researching psychedelics is in combination with therapy first, right? It involves screening and medical evaluation, very careful attention to contraindications, medication interactions, safety, emotional and physical, and starts with a preparation, bringing intentionality. And then there are supported medicine sessions with really much attention to the setting, and followed by integration. So time and a space to reflect, journal, and process the experience. It may include art, talk therapy, acupuncture, body-based practice. It may involve multiple sessions too, or just one. So particularly talking about ketamine research, there are some research suggesting support in mood for patients on hospice and palliative care. There are clear, strong evidence for depression in all stages of life. And it's feasible because it's a medicine well known since the 60s and quite safe when well held. And particularly helpful also for existential distress states. And there are many ongoing trials, both with ketamine and other psychedelics ongoing that involve patients with cancer. And this is the book. I actually was a collaborator that was launched last year from Oxford Academy of Psychedelics in Palliative Care. And here on the right is how it looks like on our research model, supervised psychedelic session at Johns Hopkins University.
I wonder if you could define existential distress, since we haven't defined that.
It's a sense of loss of meaning and purpose and disconnection that it's the state that's very common and prevalent, and I see a lot when someone faces their own potential terminality, or the changes in the body and life that can come with cancer. And it's really difficult, the medical model, to treat because there's no medicine, no drug by itself that can treat it. It's very much involves a very holistic lenses to help someone to refine their meaning and purpose and connection in life.
Sounds like a mythic model.
Yes.
Quite an undertaking to face that.
Yeah.
Well, let's go back to Julia. So we began with a story, and we began with her, and also including her family. So what would a more complementary or integrated, expanded state journey look like? Well, for her, it continued with receiving the best oncology care as possible, with the biomedical thing all working to try to cure and treat this as much as possible. And the medicines that are helping, some with ibuprofen, with pain and whatnot. But also adding and incorporating a whole person healing approach and practices, meaning her own practices, and also guidance from us at Integrative Healology. So she had a healing medical evaluation looking at her oncology care, but also this mythic mapping and what's kind of under the surface, and also exploring. And for her, it was seeing her, she really needed help to face what she was going through. It wasn't just accessible for her. So she went and explored the psychedelic route, specifically using acupuncture to help with her symptomology, like headache and nausea, and go with the to help her relax into that and reduce her symptoms. And then also having this we call ritually infused, meaning consciously created, music supported, and acupuncture supported ketamine assisted therapy, as well as dignity therapy. So that was involving really those questions about legacy and the end and what she wants for her daughters, and incorporating the psychedelic experience to support her so that she could express fully, more fully, her emotional compression, meaning the grief, the loss, the anger, the everything. And so that came out through her experience and really helped her with depression she was having and helped her connect more spiritually through that experience, and has a softening around her own fear of death, which has really helped her out and to guide her daughters too, to also guide them to understand how to help her. In addition to that, she incorporated time in nature, this nature therapy, and qigong in nature, and incorporated her daughters using time, using creating a time, creating an intention so she could nourish herself with their family, as well as other things. Like she loves music and the music from the journey. So she has that music and she plays it and she moves and she continues to weave the thread from those psychedelic experiences. And then she's connected to cancer support community and group therapy, then offered movement and yoga and emotional support. And as a result of this, without her necessarily planning, she just started to reprioritize time with her family, reconnecting with old friends started to emerge, and then just living with a greater presence that she said this is a welcome arrival. Uh, and so she's not really returning to exactly who she was before, but discovering some sort of new state of being despite all factors. And we kind of go back to this quote of healing did not mean returning to the way things were. It meant feeling more connected, more supported, and more whole within the life she was living right now,
Transcending suffering.
transcending suffering.
Yeah.
So some of you may be wondering, what is healology? Healology is something we created, a term that birthed from us. Um, Meaning we felt it was a deficit of the dictionary. So heal is to heal and become whole, and ology is the study of that, really bringing rigor and science and spiritual science to the process of healing. And an ologist, a healologist, is a well-traveled guide, meaning an embodied specialist who does their own work and their own spiritual work, and is really right there with you. And a healologist, therefore, is a physician specialist in the art, science, and practice of healing who integrates holism, consciousness, nature, and meaning to support whole being thriving. And that's our institute. So we'd love to connect more with you. We'll have some time for Q&A, and we'll send this out to, this is a link tree to learn, to find our website, to learn about our clinical offerings, our Instagram.
Sign up for our
Oh,
newsletter.
our newsletter, which is like once a month. And
Educational offerings, like
yeah,
this one.
educational offering, we're really out there. We're getting more out there too. So we offer healology medical consultations in person, virtual visits at home, individuals and couples and groups. And we're a micro practice and we run as an outer network provider to allow the maximum amount of time one-on-one with our patients. So we'll open this up to questions, and thank you very much for your attention. I think we have maybe 5 or 6 minutes left. And yeah.
Yeah, thank you so much, Thais and Justin. It was such an informative presentation. I want to invite all of the attendees, if you have any questions, please feel free to put them in the Q&A. I do see that we received one for now, so we can go ahead and get started. Someone asked, can psychedelics be taken while patients are on chemo or are undergoing other treatments?
Yes, great questions. So they can come in parallel. It's a collaborative work with your oncologist or whoever is leading your care to know the exact timing for best incorporating it. But to say that particularly ketamine-assisted therapy, well held with like physician support like us, it can be concurrent with treatment also, and also in preparation for it or after. It really depends if you want to add anything.
I think that's where
The
us
evaluation.
checking, especially these new chemo medications, is to have a rigorous medical evaluation
Mhm.
for interactions. Luckily, ketamine does not have a high amount of interactions, which is why it's a very useful tool to use in the lower doses to engage with psychedelic experiences. If you're referring to, we'll call them outside of this medical, meaning like psilocybin or things that are not federally legal or accessed through a clinical environment, there can be more interactions just inherently with them. So it's valuable to have it be the more that the practitioner is knows the biomedical terrain, it's better, and it's better to have like a collaboration with the oncology team to understand what you're doing and why. And if it's like I'm working on
Me.
healing and also timing, because it requires energy and robustness, and sometimes the that work should be done. You said the word held. What we're referring to held meaning like supported, like fully supported. So no matter what transpires during that journey, you will be held. Meaning it's like responsibility, like you would do a surgeon. The surgeon is responsible for the surgical experience and what happens. So that's this kind of responsible, ethical holding that we're referring to.
Yeah, and also that the psychedelic, like expanded state, can be with like the ritual intentionality music, can be accessed also just like we practice acupuncture in a very particular way where we incorporate vibration and sound and intentionality that it can really take you to just an experience on a journey, literally, and has literally no side effects or contraindications with not even using medicines. It's just supporting your body to cultivate those endogenous, like psychedelic substance. Like our body has this capacity.
Yeah, I think that's another thing that we've learned, and kind of we're surprised at how deep people can go when you set an intention to go deep. You offer something with their body in a safe environment like acupuncture. You use music and vibration. There's no psychedelic medicine, there's no ketamine. People will go very deep. Things will emerge, images, releasing can occur of emotion. Um, and then afterwards, there's stuff to process. So I think the concept of like having a psychedelic experience with a psychedelic medicine as the only way, or that's the big way, is something that we have found to be very to soften with, because it's just like you tailor based on the condition and where they're at, what is the intensity that is needed to get people where they want to and need to go. And we never underestimate the power of meditation, acupuncture, and being present with someone. You never know when someone will release or find their way. So we really just, it's a highly customized thing and literally an intuitive call, which is not taught during our medical school training. It came through our own meditation and our own work.
Perfect. Thank you so much. I have a few more questions. I see that's past one, but we'll answer a few more.
Okay.
Someone asked, how can you access psychedelics like ketamine treatments for someone who has limited resources?
Good.
That's a good question.
Yeah. This is still like a, a system barrier, definitely, because the systems often require more like a long support system, depending on the circumstances. If this person particularly has like also like severe depression, there is like a type of ketamine that is covered through insurance for a particular group that has treatment resistance, has tried many other treatments and depression and combined with connecting with resourcing to help guide them through the experience to not just use it as just a pure medicine, because really the healing from psychedelic comes with the relational exploration and the reflection and the preparation more than just like the substance per se. But to say that like that is one pathway through insurance that like if one meets all those criteria of coverage, they can access the substance, but you still need a little bit more support. What would you say?
Yeah, so that would be called Spravato, and you
Yeah,
can explore that. And it's also good, some people do well with that. And it doesn't ensure that a transformative or mythic experience or healing experience occurs. But it can really help people. So that's one tool. And also, never underestimate the power of a meditation retreat. Never underestimate the power of a retreat and also there are emerging some lower cost like group models. I think some nurse practitioners have offered that, and that's also something we're exploring too, like how to,
exactly.
because groups also are quite powerful and also allow
Mhm.
it to for people and clinics to be able to offer this. But the insurance world is not very supportive of time with a physician, time with healers. It's about quick and productivity. And so unfortunately, it's like it's hard. But some other things too can be helpful, like out-of-network coverage and super bills, FSA, HSA accounts, if you have those, can help just offset the inherent cost to heal. It really is.
And just again highlighting that there's so many pathways right now. Psychedelics may sound like sexy, more like attention being played there, but it's literally like we mentioned, nature. It's there. Like there is like many free ways of accessing support too.
Yeah. And
Thank you. And then another question is, how much exposure to nature is considered clinically significant? For example, 3 times a week for an hour each session. Just a little, can you talk a little bit more
Yeah,
about that?
sure. There are many. So there are many different research and like quantitative, trying to qualify well, how much, But I think the most important than how much time is like the presence you have when you're there, is really feeling being part of nature, being with nature, is literally bringing mindfulness to nature. And amount is like as much as what fits in your day and what you can. And I'm gonna add more from that. Because
yeah,
yeah.
I would agree. It's like that question, how much do I need to feel that effect? Because these therapies are so personal and in a way we're kind of trusting their own inner intelligence that is exemplified by nature itself. If am I the tree is just there, but do I not have some connection like the tree? I grow if that's true and we're connected, then you can do your own exploration. So I would turn it back to you saying like, if you make a conscious intention to connect, you set I don't know, maybe choose a time, maybe even a few minutes, or if you're even outside, is being next to a tree, and you can see what feels nourishing to me based on your goal. If you're trying to have reduced stress, that's one approach. If you're trying to connect with your feelings or your emotion, that's a different thing. So you can see what is it that you need. I know for me in the morning, if I'm wanting to really connect with my body, I'm a 20-minute meditation guy. Otherwise, my anxiety in the morning is high. This is the way I've been built from my past. So I've learned to calibrate and adjust what I need so that I can feel and begin my day feeling connected. So I invite you to find your own intelligence. And that's kind of the approach that we have is like people are very intelligent, very wise. They just maybe have forgot and no one pointed to them that they are.
Thank you so much. And we
Mhm.
have time for one last question.
Ooh, okay.
So someone said, can you share more on creating an environment where healing and clarity are improved? I use gardening as my safe environment for process and release of tension.
Did you say are approved? Could you repeat that question
Yeah,
again?
yeah, yeah. It says, could you share more on creating an environment where healing and clarity are improved? I use gardening
Oh,
as my safe environment for process and release
Mhm.
of tension.
yeah. So that's this gardening. So what is gardening? So in order to have a garden, one needs to have, I'm going to speak kind of poetically. So one would have needed to have a space where they say, this will be my garden, or I adopted a garden. then that space becomes an intentional environment where one now needs to tend the garden, and maybe you have the consciousness of the certain seeds, or and then you have a certain skill set that you had to maybe have had, or maybe that's from your my grandma had a garden. So all this is happening. And so seeing all of that, and then at some point one has to tend to the garden. The garden will say, "Hey, I need some water. I need some tending. Oh, here's the pest, and now here comes this. How do I engage with this invader?" So I think the more that you can bring mindfulness to it and the ritual to it, um, time, if you set time, that can be helpful for some people. Then it really can augment the experience. And it comes from I'm gardening to do this to I'm engaging with nature in a direct way. And it becomes a little spiritual because it's like, I don't know how that thing produced a tomato. That's an interesting thing. I know I put the seed, but I didn't do it. So once you can engage with that and open a little bit to the awe of it, I think that's when things accelerate and really grow. And so you may go also if you're not feeling well, and maybe if someone has a cancer diagnosis, they're engaging with that. Maybe they poke their finger on a thorn and they go, and they may can express their emotion through that, or they're digging a hole, it doesn't need to be just, oh, it can be very aggressive and intense. So that environment can be like a playground for therapeutics.
And seeing,
And bring a friend,
yeah, that's created a
or see an
relationship
animal, or bring an animal, or see the animals that show
that
up.
are already there, the worms.
Yeah.
And yeah, and just noticing the cycles and the changes and the mirror relationship between the garden and you in the garden. And
Yeah. So these open up when there's a little bit of sprinkle of awareness. We'll call it mindfulness, when things really get going. But, that's our secret sauce, I think.
Perfect. Thank you so much. I know we're a little bit over time, but
Yep.
I just want to thank you, Thais and Justin, once again for joining us today and sharing your expertise. And thank you to our participants for your engagement. I do have one last slide that I will share.
Okay.
Uh, So if you all would like to learn more about Cancer Support Community Los Angeles, please feel free to visit our website at cancersupportla.org. And if you have any questions or would like more information about how to get started with our services, please feel free to email us at info@cancersupportla.org. I also wanted to share a class that we currently offer. It's a power yoga class that meets online every Saturday from 10 to 11 a.m. And you can scan the QR code to get started. And again, if you have any questions, please feel free to reach out. I want to thank Thais and Justin once again. We really appreciate you
Thank you all
being
for
here.
thank you
coming. Thank you,
And
for the
Abby.
thank
invitation.
To the
and thank
community.
you everyone for joining us. And we hope to see you all at a future webinar. Thank you, everyone.